Okay. Actually, the next question that we'll segue into is how you take the medication and what it looks like. But when you do try, let's say, semaglutide, what can you expect to see or feel for the first couple of weeks?
So, when you're first starting on it, you may or may not have any side effects or feel any different per se. But what you should notice for sure is that you're not thinking about food. You're not craving foods, especially the bad foods, foods that are bad for you. You want to make sure you are eating still all of those healthy, nutritious foods because you need to get that nutrition in, and that's always part of it. Some common side effects. So if you do experience any side effects, they're typically within the first few days after your injection. 'Cause this is a once weekly injection, but it's going to be things that affect your gut because that's where it works. So mostly nausea, heartburn, maybe a little bit of constipation. And there are ways to counteract those side effects if you do experience them. You can just reach out to your provider. If you do experience them, you can just reach out to your provider.
Okay, that was awesome. So, Jennifer, what exactly is the dosage? And
So when you start on GLP-1, such as semaglutide, the starting dose is going to be 0.25 milligrams. And then that's going to be an injection once weekly that you will give yourself into your subcu tissue. Now, that is a starting dose. So that's what we would term a loading dose. So some people will experience some weight loss on your loading dose. Some people may not. Our goal is to get you to your therapeutic dose, and that looks different for everybody. A lot of times underneath the arm, or your abdomen, that's probably the most common place that people will give themselves these injections, or the top of your thigh, just anywhere that there's fatty tissue.